Now, despite mass vaccination program against COVID-19, infection rates in Britain remain stubbornly high, contrasting sharply with its European neighbours. Now, for 2 weeks, the number of new COVID cases has wavered between 35,000 to 40,000 a day. On Monday, the number nudged closer to 50,000, the highest since the July peak of the Delta variant outbreak. The daily death toll has often exceeded 100 since summer, adding to an overall toll of more than 138,000, second only to Russia and Europe. Scientists have already voiced fears that high underlying numbers of cases could overload the state-run National Health Service. Experts believe that the rate of infections among older school-age children is driving force behind the sustained tide of new infections.
And I think the other concern, of course, at the background of all of this is this the possibility of a perfect storm over the winter, because we've got flu. We know we want flu vaccines to be rolled out in youngsters as well. And for the first time, that's all the way up to the 16-year-olds as well, with other respiratory virus infections, with all of what that means, not only again for schools, but also for overwhelming the NHS. So I think if you add that into the mix, then the worry is that autumn winter is going to get very, very messy.
We allowed people to make their own decision in a rather marginal situation whether or not they wanted their children immunized. Those that did went ahead, which is fine. Those that didn't go ahead, and that's fine too.
The problem at the moment for that is that you have a slow rollout of this process in the time when you also have a high case rate in that age range. And that's causing problems with getting the vaccines to children who want to have the vaccines.
Now, vaccination rates are low among school children in Britain. Masks are no longer mandatory. The government, however, said earlier this month that they could be reinforced if cases continue to rise. Britain let go of COVID restrictions in July, ending social distancing and mask mandates, although many transport operators still require them. Proof of vaccine for visiting crowded places such as restaurants, theatres, nightclubs is also not mandatory in England. It has also just been introduced in Wales and Scotland. So far, 86% of those above the age of 12 have received their first dose and 79% are fully vaccinated. Britain is now running an autumn booster campaign with frontline health and social workers, the first to receive the third dose. Boosters will also be offered to those aged 50 and above and younger adults with certain health conditions. WION is now available in your country. Download the app now. Get all the news on the move.